Today we are going to discuss the lower limb, one of the lower limb bone, that is a femur. So this femur is one of the longest and strongest bone of the body, and this is we call as that is the thigh bone. So whatever, when you see the femur, this is the one bone which is, you can see the muscle attachment of the femur, and on the linea aspera aspect we are going to deal with this bone, and external features and all will be studied with this bone. When you see the bone introduction, femur we are going to study under the introduction, site determination and anatomical position and external features in this lecture. So femur introduction, one of the longest and strongest bone of the body, and it is also called as a thigh bone. And this femur which is there, this is one of the long bone. Like other long bone, it is it is having the upper end, shaft and lower end. So that this upper end consisting the head, and we have the greater trochanter, and posteriorly we have the lesser trochanter, intertrochanteric fossa. So that here in the upper end, shaft of the femur which is cylindrical in shape, so that we are going to deal later. Then lower end of the femur. So my intention here to see that in the introduction you have to add the femur is the longest and strongest bone of the body, thigh bone, and is situated in the thigh region. And this is a femur which is like a other long bone having the upper end, shaft and lower end. Now we are going to study what are the anatomical position and site determination of the points of the femur. So I am talking first about that is a site determination of the femur. So first point you have to tell, upper end bears the rounded head. Upper end bears the rounded head, whereas lower end is widely expanded to form that is a medial condyle and lateral condyle. This is the first point. And second point, the cylindrical shaft of the that is a femur is convex forwards. Then head of the femur, which is the head of the femur, is directed medially. So upper end bears a rounded head, whereas lower end is that is widely expanded and forming condyle. First point of the site determination. Then head is directed medially. Then this is a shaft convex forward. So these are the 3 points of that is a site determination of the femur, so that it is we are going to get as a right femur. Then going to the next, that is a anatomical position of the points of the femur. First one, upper end bears a rounded head. This head is directed medially and slightly upwards and forwards. So this direction will be there, directed medially, upwards and forwards, that is a head. Then when you see the cylindrical shaft, this shaft is obliquely runs downwards, whereas the inferior surface of the two condyle lie in the same horizontal plane. So this is the second point, whereas the shaft of the femur runs downwards and medially, so that inferior surface of two condyle lie in the same. The shaft of the femur is convex anteriorly, and this shaft runs obliquely downwards and medially, whereas inferior surface of the two condyle lie in the same horizontal plane. Second point of the anatomical position is that the shaft of the femur runs obliquely downwards and medially, whereas inferior surface of the two condyle lie in the same horizontal plane. So these are the 2 points where you can remember for the anatomical position of the femur. So revise, that is the anatomical position point. The head of femur is directed medially, slightly upwards and forwards, and shaft of the femur runs obliquely downwards and medially, whereas there is an inferior surface of the two condyle lie in the same horizontal plane. So this is all about the anatomical position of femur and site determination of femur. So now we are going to deal about the external feature or general features of the femur. So when you see this, this is one of the long bone, as it is other long bones, like it is having the upper end, shaft and lower end. This upper end, we are going to discuss the upper end of the femur. In this, you can see the upper end of femur, that is consists the head of femur. This is the neck of femur, neck, and this is the one which is a greater trochanter, which is we call this a greater trochanter, and this is a lesser trochanter. So greater trochanter, lesser trochanter, we have the neck of femur, and this is the head of femur. And on the head there is a centrally, on the center of the head there is a depressed part, that is we call as a fovea or the fovea capitis. This is a rounded head, articulates with the acetabulum forming the hip joint. This is the neck, whatever the neck connects the head with the upper end. So this is neck, which is a part which is there, this neck part which connecting the head with the upper end, and this will form the one angle which is we call neck shaft angle. This is a neck shaft angle. This neck shaft angle is about 125 degree in adults. So that is the, you have to remember in the neck shaft angle. The upper end, which is consists the greater trochanter, and this greater trochanter is situated at the upper limit of the shaft, and this is having the apex of the greater trochanter, and posteriorly, which is we call as a lesser trochanter, and this is a conical prominence. And these all, after this, the anteriorly we have this intertrochanteric line, and on the posteriorly we are going to have the intertrochanteric crest, and inside this, in the greater trochanter, we call as the intertrochanteric fossa. So intertrochanteric crest, intertrochanteric fossa, and we have the intertrochanteric line. So upper end of the femur consists the head, neck, greater trochanter, intertrochanteric line. Then I have told the intertrochanteric fossa and intertrochanteric crest, and this is a lesser trochanter. So this is all about the upper end of the femur. Then going to the shaft of the femur. This shaft of the femur is cylindrical in shape. The shaft of femur is cylindrical in shape, and it is a convex forwards, so that this is divided for the study purpose, upper 1/3, middle 1/3, lower 1/3. So this upper 1/3 of the femur is having the 4 borders and 4 surfaces. Middle 1/3 is having the 3 borders and 3 surfaces, and lower 1/3 of femur is having the 4 borders and 4 surfaces. So now we are going to discuss the first one, upper 1/3 of the femur, shaft of the femur. As I have told, the shaft of femur is cylindrical in shape. So upper 1/3, it is having the lateral border, and this is a medial border. Then posteriorly, this is the one which is we call spiral line, and lateral lip of the gluteal tuberosity. Lateral lip of gluteal tuberosity, spiral line. Then we have medial border, and this is the one which is a lateral border. So now we are going to deal about that is the middle 1/3 of the shaft of the femur. The middle 1/3 of the shaft of femur, when you see, this is a ridge-like and prominent and posterior border is called as a linea aspera. So here you can see this is the middle 1/3 of the shaft of the femur, where the posterior border is middle 1/3 posterior border is prominent ridge-like. This prominent ridge-like, the posterior border is called as a linea aspera. This linea aspera diverges below as a medial supracondylar line, then lateral supracondylar line. Then going to the above also it diverges, forming the spiral line, then lateral lip of gluteal tuberosity. So that this middle 1/3 is very important. The posterior border is ridge-like and prominent, and this posterior border middle one-third we call as a linea aspera. So linea aspera is having medial lip and this side is lateral lip. So lateral lip, which is we are going to get the lateral lip of the linea aspera, medial lip of the linea aspera. So this is the one about the middle one-third of the shaft of the femur. Going to the next, which is we are going to lower one-third of the femur. This lower one-third of the femur, when we see anteriorly, this lower one-third having the four borders and four surfaces. One four border, this is a medial border, this is a lateral border. Then we have this is a lateral supracondylar line and this is a medial supracondylar line. We are going to get the four borders. Then going to the surfaces, four surfaces. Here we have the anterior surface. This is a lateral surface. This is a medial surface. And posteriorly we have this posterior surface we also call as a popliteal surface of femur. So this is all about the study of that is a shaft of the femur, upper one-third, middle one-third, lower one-third. So in generally, for the study purpose, shaft of the femur is divided upper one-third, middle one-third, lower one-third. So that upper one-third, which is there, this upper one-third of the shaft is having four borders, four surfaces. Middle one-third having three borders, three surfaces. And lower one-third is having the four borders and four surfaces. Now we are going to discuss about the lower end of the femur. The lower end of femur, which is consist of the two condyles, which is we call as this is a medial condyle and lateral condyle. Anteriorly, we are going to have the patellar articular surface of the femur. So here it is on the medial side, medial condyle, and this is a lateral condyle. When we go to the posteriorly, this posterior part where two condyles are separated by the intercondylar fossa. The two condyles posteriorly separated, that is we call intercondylar fossa. And this intercondylar fossa is having the one which is we have this is the lateral epicondyle of the femur and medial epicondyle. So medial epicondyle and lateral epicondyle, intercondylar fossa, and these are the two medial condyle and lateral condyle. This is the patellar articular surface of the femur. So this is about the lower end of the femur, lower end forming the knee joint. So this is one articulates with the upper end of the tibia forming the knee joint. So this is all about the lower end of femur as general features and external features, and this is a shaft we have dealt, and this is the upper end of the femur. Two angles you have to remember. One angle which is I have told this is a one called as a angle, that is a neck shaft angle. Neck and shaft angle is about 125 degree in adults. Then one more comes about the angle. Angle of femoral torsion is 15 degree, where the longitudinal axis of the upper end and lower end. This longitudinal axis of lower end comes here. Longitudinal axis that is we are going to get along that is coming here, and that is forming the 15 degree. So we have the axis, this we call as an angle of femoral torsion. So this is the one which is you have to remember in the two angles. Angle of femoral torsion 15 degree and neck shaft angle is we call as that is a 125 degree. So this is all about the introduction and side determination point, anatomical position, and we have studied the general features of the upper end, shaft and lower end of the femur. So most important, linea aspera, which is a prominent posterior border of the femur, which is a thick ridge-like prominent posterior border of femur. This is we call as a linea aspera. It diverges upward and even diverges downward, that you have to remember. Then we are going to have the three tubericles. This is one which is we call as a quadrate tubercle, which is gives insertion to the quadratus femoris muscle. Below this, which is we have the this is a gluteal tuberosity, which gives insertion to the gluteus maximus muscle. Quadrate tubercle, gluteal tubercle. Quadrate tubercle gives insertion to the quadratus femoris, and gluteal tubercle gives insertion to the gluteus maximus. One more tubercle we have on the medial side, we have the that is the adductor tubercle. Here we are going to get the adductor tubercle, and this adductor tubercle gives insertion to the adductor magnus muscle. So three tubercles we have studied: adductor tubercle, then we have come across the gluteal tubercle and quadrate tubercle. So these are the three tubercle and three insertions muscle attached to it. So here we have covered the general features of the femur and anatomical position and site determination of the femur.